Body Integrity Identity Disorder, or BIID, is a very rare and stigmatised condition where healthy individuals want to become disabled. Sufferers have reported a desire to become blind, paralysed, or most commonly amputate a limb. In extreme cases, some have been known to take matters into their own hands, even resulting in death. Will they ever be able to live happily with their condition? And how can the NHS help them?
From a really young age, I remember thinking I shouldn't be able to walk.
Trying to live as a blind person when the world doesn't recognise you as a blind person is very challenging.
Professor Neil Levy at Oxford University has been studying BIID for over a decade and a half. He tells us how the condition is often confused for a sexual fetish.
For a long time, it was classified as a sexual disorder. It was believed there was an overlap, so that people who wanted the limb removed were themselves aroused by the thought. And although there does seem to be an overlap, there seem to be people with many people, perhaps the majority, with, if you like, pure BIID, no sexual element whatsoever.
We spoke to Beth, not her real name, who lives in the Midlands. For most of her life, Beth has wanted to be paralysed from the waist down. We asked her if this was part of a sexual fetish.
For me, that's not part of my feelings, the sexual bit, but for some people it's a big element. When contacting other people online who have BIID, or at least profess to, there's a big chunk of them that are looking for sexual gratification, and I have to be really careful with that. There's a lot of real weirdos who frequent these forums.
Nicola Stockley produced and directed Complete Obsession in 2001 for BBC Horizon. She told us how people reacted to the controversial documentary.
People were shocked by the film, not least because they had associated the idea of wanting a limb removed with some kind of masochistic practice. And it had become, in many people's mind, with some kind of sexual fetish.
For most, their BID has nothing to do with sex. Like transgender people, they simply see themselves as born with the wrong body.
Tell us what he said.
He said, "Mummy, I'm a boy in a girl's body."
People often report in that case that they feel as though their assigned gender doesn't match how they want their gender to be very early, 5, 6 years of age, sometimes even earlier. And people with BIID often report something similar. It's a rare condition, and we haven't got good longitudinal data over time. So we really are in the dark.
This is 18-year-old Michael, also not his real name. He has both Asperger's and BID. He wants to be blind and is what is called a pretender in the BID community, meaning he acts as if he has a disability whenever possible. What would be your ideal wish? That you would have no eyesight or one eye? Can you tell me specifically what it is?
No sight at all, completely blind, yeah. And I don't think about it, I don't really, it's just how I am. When I'm sighted, I think, I'm always thinking about, how things would be if I was blind. I'm always thinking about being blind.
Moheb Kostandi is a neuroscientist and is currently researching the condition for a chapter in his new book. He gives his theory of why anyone would want to disable themselves.
I believe that BIID has a neurological origin and that it arises because of a discrepancy between the physical form of the body and a higher order neural representation of the body, which I call the body image, which we think is encoded in a part of the brain called the right superior parietal lobule. That is to say that the affected limb is missing from the brain's representation of the body.
Occasionally, people have resorted to using unqualified surgeons abroad because they have been refused the surgeries where they live. Some have died as a result of complications from these surgeries.
I think there is a real danger that those people will find other means. Certainly, one of the reasons that the surgeon who we were filming with at the time was convinced that it would be better to do the surgery was because he had known of people who just gone in front of train tracks.
Have you ever considered going down the black market route?
I've considered it, but I wouldn't know where to get it done, and it's also a really risky procedure. I would need a very skilled surgeon, someone that I trusted would be able to do the surgery well, with a care team that would be able to ensure that I wouldn't get an infection, and that I would end up with the disability I need and not a different kind.
I have considered that, however, there are no, as far as I can tell, there are no known black market surgeons offering surgery to become blind. So as much as I have considered that as an option, the option isn't really there, as it were.
There's one very well documented case of a surgery that went drastically wrong, of an elderly man from New York who travelled to New Mexico, I believe, in 1998 to visit an unqualified doctor who agreed to amputate his leg, and he died of gangrene in a motel a week later.
Sufferers talk to each other on internet forums about the challenges they face living with BIID. Many of these forums have started to close, often leaving sufferers with no one to turn to.
We don't fully understand. Sometimes feel unhappy about themselves and their body image.
Dr. Mark Salter is a spokesperson for the Royal College of Psychiatrists. He's reluctant to endorse amputation, but does believe more can be done for people with BIID.
Very often they become more cheerful when they settle upon the idea that if only I could do this, this will be better. And this particular idea focuses on the idea of self-destruction, self-mutilation. And I know of one case where a man, a loving father of two, happily married, announced to his family at breakfast one morning that he would remove his limb because it would make him a happier person. He pursued this relentlessly to his GP, to countless specialists, a number of psychiatrists who found he wasn't psychotic. He had a clear capacity decision that he wanted to hurt himself, but said he wouldn't at any particular time because of the distress that it caused. After he'd been turned down by countless clinics, he logged onto a website one evening on how to amputate your left leg and did so. He didn't manage to read the bit about clamping the arteries in time, and one afternoon when his wife returned home, she was distressed to find her husband's corpse exsanguinated on the kitchen table. Now that could have been avoided.
I tried things with lasers, I tried things with sunlight, I tried infrared radiation. So I tend to focus more on methods that involve damaging parts of the internal parts of the eye, so damaging the retina, the optic disc, the optic nerve.
We sent Freedom of Information requests to the Department of Health and their devolved counterparts, asking how many people they diagnosed with BIID in the past 10 years. They referred us to local health boards, none of which had any records of people being diagnosed with BIID. Yet in the past 2 months, we've spoken to over a dozen people with the condition. It's clear that BIID exists, but that the NHS have a problem with diagnosing it, or at the very least, categorising it. All of which comes as no surprise to Beth.
I'm sure that there are a lot of people out there who have it but haven't spoken about it or haven't been diagnosed with it or connected with outside forums. I wouldn't appear on any statistics if the NHS was asked for statistics because I haven't spoken about it with my doctor or anyone else. There are a lot of people that won't either, as they won't find the online forums or want to get involved.
There are more people who suffer from this than would ever go to doctors. So I think it's fair to say that there are going to be more people there than numbers will ever know in terms of numbers.
It may well be that there are people who are under the radar who have been successfully treated.
There are conflicting views as to how the condition should best be treated. Some advocate therapy, others insist only surgery can solve the desire to be disabled.
I don't think that anyone knows what the best way to treat this disorder is. I think it's baffles the people who have it, and I think that it's still deeply difficult for medical practitioners to know how to handle it.
As far as we know, nothing other than amputation will actually get rid of this desire to have the unwanted limb removed. Patients that have been documented so far have undergone various types of psychotherapy, cognitive behavioural therapy. They've been treated with antidepressants and all sorts of other, perhaps even antipsychotics. And as far as we know, none of these treatments has been at all effective in alleviating their symptoms or even reducing this desire to have their arm or leg cut off.
I don't think they should be allowed simply blankly because they've been given this disorder. I mean, we have to remember that, removing a limb is drastic and not to mention life-threatening. Some people tend to do these things themselves. And by talking up the idea of this being a single coherent clinical entity that is a disorder, it may even encourage other people to construe themselves in those terms.
But even if surgery was a proven treatment for BIID, many would question whether the NHS should be in the business of disabling healthy bodies, especially in a time of austerity.
And I think in the absence of that absolute ethical clarity, we should err on the side of caution. Now, that might sound cynical or cruel to those who, for one reason or another, want to advocate that this treatment is available. But looking at it, especially in its cash-strapped times and terms, when we're thinking actually of withdrawing the funding of things like in vitro fertilisation, the right to treatment of infertility on the grounds of insufficient resources, for what some would see as a luxury, to be able to have children, a right, I think to go one stage further and to mutilate an apparently physically healthy body, regardless of the stress it causes, should not be sanctioned by the limited public purse.
If it were only available in private medical practices, then that would almost certainly lead to a situation where only some patients can afford to have the surgery.
I think in the end, whether it's private or whether it's not isn't really the point. I think what you have to do is to be absolutely sure that, first of all, that you're diagnosing somebody, and then before you take the enormous step of surgery, you have to be sure that's the right thing to do.
I think it's very important to ensure that if we do go down the surgery route, I think there are at least some cases in which we should, that we do have some kinds of safeguards in place.
There are people that have such psychological distress that there's no other option, in which case, yes, if cutting someone's arm off or leg off actually relieves their psychological distress to a point that they can become a functioning member of society, then yeah, absolutely.
Having experienced, obviously, the effect that BIID can have on someone's life, I think it's unfair for that person to be put through that suffering. Personally, the only way I would have access to surgery is through the NHS, because I simply don't have the money for paying for surgery, black market or otherwise.
Some would argue that efforts to help such a small group of people are a waste of scarce resources in a time of public spending cuts, but few can doubt the genuine suffering of the individuals involved. Perhaps if the government thinks that surgery is too radical an option, it should consider researching other treatments that can be offered. It seems unlikely sufferers will ever be truly happy until they get some form of help.